Ladies, do you have a lot of weird things going on with your body and you have been to multiple doctors, multiple specialists, and nobody's been able to put the pieces of the puzzle together? Well, I've had many patients coming in recently with a variety of symptoms, and they don't understand that they're all connected to their pelvic floor. So today we're going to talk about the top 10 signs of pelvic floor dysfunction, and I really want you to stick around to the end because I'm pretty sure the last one's going to surprise you. The first symptom is pelvic pain. This is usually what will bring people into my clinic because they are starting to have pain either with urination or just during their regular daily activities. Now, obviously, pain with urination could be a urinary tract infection, and you should definitely get that checked out if that's what you feel like it is, that burning pain that happens when you're urinating. But pelvic floor pain is a little bit different. And I will say, if you have chronic UTIs and the doctor can't tell you exactly why, my guess is that's a sign of a pelvic floor dysfunction. The second sign is one that will come out when I'm talking to patients, and that is falling on your tailbone as a child. Now, often many people did fall on their tailbone and we just didn't think that much about it. It was when we were roller skating, if you're an 80s child, ice skating, maybe you were horseback riding, or anything can happen that you would fall on your tailbone. However, we didn't think much of it because we were young and springy and bouncy at the time, and it didn't seem to affect us. However, that may have thrown your tailbone off, and over time, as we age, when our elasticity decreases, it tends to show up as a pelvic floor dysfunction. The third most common sign is difficulty with urination. Now, this could be increased frequency, which is commonly what we think of with pelvic floor dysfunction. However, it can be difficulty fully emptying. I had one patient come in who was 26 years old who ended up having to go to the emergency room because she could not empty her bladder. And she actually had to be catheterized in order to be able to empty her bladder. Now, of course, the doctor said, okay, everything's fine now, and sent her on her way. However, when she got home, they hadn't solved the root problem. They had emptied her bladder, so she definitely felt better, but they hadn't dealt with the pelvic floor dysfunction. So she ended up in the emergency room again because, again, she could not empty her bladder. At that point, the doctor told this 26-year-old woman that she was going to have to use a catheter for the rest of her life. Now, friends, can you imagine being a 26-year-old woman and being told that you have to use a catheter for the rest of your life? It's ridiculous. So of course she ends up in my office asking me, do I think that this is a pelvic floor dysfunction? Yes, ma'am. I definitely think that this is a pelvic floor dysfunction because 26-year-olds should be able to urinate without catheters. The number 4 sign of a pelvic floor dysfunction is if you have to get up 2 or more times at night in order to urinate. Now, many people who are listening to this who are older are going to say, oh yeah, I have to get up multiple times during the night, but that's just normal as you age. Friends, I want to tell you that doesn't have to be normal as you age. Getting help for pelvic floor dysfunction can keep you from having to get up multiple times during the night. Now, I do understand that our bladder tends to be a little bit less pliable, especially as we get up into our 60s, 70s, and 80s. However, we should be able to sleep through the night only getting up once or twice, even if you're in your 70s or 80s. And to my friends who are in their 40s and 50s, if you cannot go all night without getting up, you need to seek help from a pelvic floor specialist. There is no reason why you should have to get up and urinate in the middle of the night. The number 5 sign, and I would say this is the second most common that actually brings people into my clinic, is that people feel a bulging in their vagina as if there's a golf ball in there. And usually people will notice this when they're in the shower and when they're washing, and it's very concerning because it seems to come out of nowhere. So that's called a prolapse most commonly is what's happening, and that is clearly a sign of a pelvic floor dysfunction and definitely something that can be treated. Often many people will go to the doctor and the doctor will want to talk about doing surgery. However, it's not necessary to have surgery for a prolapse. There's natural ways to treat that without cutting on your body. The number 6 symptom of pelvic floor dysfunction is difficulty controlling your bowels. Now, for some people, this will come out as a diarrhea or difficulty holding things in, but for many of my patients, it actually comes out as constipation. And they don't understand how their constipation is related to their pelvic floor dysfunction. Well, you see, it all needs to come out through the pelvic floor. And if you can't relax your pelvic floor to fully empty your bowels, it will stay in there and it will get dry, which makes it more difficult. So what you should be doing is pooping every single day. And the goal for the shape, I call it a fat snake. That shows that everything's able to move through easily and there's no pelvic floor dysfunction. The number 7 sign is pain either with intimacy or when you're inserting a tampon. So anytime anything's going in, it's causing pain. Often when people first notice it, they think, it's not that big of a deal. It'll go away over time. It only happened once. Friends, I am here to tell you, it probably will not get better on its own. Now, okay, if it happens once a year and it's just kind of a weird thing, okay, I can handle that. However, the second time it happens in a brief period of time, you need to seek help. I have many patients who wait a long time thinking it'll just get better on its own, and it doesn't get better on its own. It gets worse. It leads to things like prolapse and constipation, and then we're dealing with multiple systems and it takes longer to heal. The 8th sign of a pelvic floor dysfunction is that if sexual activity increases other areas of pain. So you may be aware that the pelvic floor is kind of the floor of the entire body, and it's intimately connected with the hips, the abdominals, the low back, the spine, the pelvis. Everything kind of rests on the pelvic floor, like literally. So when patients have pain with sex, often it will cause a cascade of other issues to start as well. The 9th most common sign that many people don't consider necessarily with pelvic floor dysfunction is pain with prolonged sitting, such as if you're sitting for work, in a meeting, at a conference, on an airplane, or in the car if you commute long distances. They don't understand why their pain will only happen with sitting, and it's because the position that you're in that's putting increased stress onto the pelvic floor. It's important to understand why sitting causes this pain so you can figure out what you need to do about it. All right, are you ready for the last most common symptom? I told you that this one was going to surprise you, and it surprises most of my patients who come in here because what brings them into my office is not pelvic floor dysfunction, but it's pain in their hips, low back, sciatica, abdominals, weakness in their core, difficulty taking a deep breath. All of these things are what people come into my office complaining of, and it's actually the sign of a pelvic floor dysfunction. So if you've had hip pain or low back pain or sciatica, and you've been going to doctors, you've been going to other physical therapists, and it's not clearing up, chances are good it's because they're not dealing with your pelvic floor dysfunction that's actually driving these problems in the first place. This is why it's super important to work with a specialist who can deal with not only the area of pain, but figuring out the other structures that are putting stress on this issue. Now, if you are suffering with pelvic floor dysfunction and you've been trying to do Kegel exercises because you feel like that will help, I'm going to recommend you check out this video here. I am not a big fan of Kegel exercises, but I am a huge fan of this exercise. This is the one that I do every day that keeps me being able to run into my late 40s and eventually into my 50s and 60s. I recommend all women do it every single day. If you suffer with pelvic floor dysfunction, do it twice a day.